Welcome back. India's financial capital Mumbai is emerging as one of the major coronavirus hotspots with over 200 confirmed cases. A fresh case was reported from Dharavi, the largest slum area in the city, triggering community spread concerns. The patient is a 54-year-old sanitation worker. This after a 56-year-old man from Dharavi passed away just yesterday. The youngest patient of the city is a 3-day-old infant. In fact, this infant allegedly caught the virus as he was kept on a bed vacated by a coronavirus patient at a hospital in Mumbai's Chembur. The family has blamed the hospital for carelessness. The mother and the infant are now undergoing treatment at a Mumbai's Kasturba hospital. An Air India crew member, on the other hand, has also tested positive for coronavirus. The official was involved in one of the evacuation operations there conducted by Air India. In Navi Mumbai, 5 CISF jawans have been tested positive. Maharashtra continues to be the worst affected state in the country with 280 active cases and 16 deaths reported. Now, as India now enters day 9 of the nationwide lockdown, prices of essentials have also gone up. Take a look at this report.
We're on ground zero to find out whether the prices of pulses have increased in the city and suburbs of Mumbai or not. We visited a few areas like Lalbagh, Dadar, Bandra, Sion, and we realized that barring 2 or 3 pulses, generally the prices have not increased. So I have the entire list of the various pulses with me, and here it goes. Moong dal has increased from 120 to 140 rupees per kg. Tur dal from 100 to 120. Rajma remains same at 140. Chana dal, of course, has increased from 80 rupees to 100 rupees. Kabuli chana remains at 100. Flour, of course, has increased from 40 to 50 at many places. What's interesting here is, as many shopkeepers also say, that chana dal and tur dal comes from Gujarat. And since the lockdown, there are no transportation facilities as such. And that is the precise reason why the prices of these 2 main pulses is increasing substantially. And in the days to come, might even further increase. It is the Aam Janta or the common man which is feeling harassed and asking only one question after all: when is this situation going to normalize? With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
Well, clearly that is the question. When are we going to get back to normal life? But in the meanwhile, we're looking at several shocking visuals that have emerged from Mumbai's Dharavi. Before that, let's quickly go over to Devesh joining us live. Devesh, do tell us. We're looking at situations where people are losing their minds out of frustration, attacking police officials. We also hear that a young group of men attacked police officers there. Even though they were asked to stay at home, they came out, tried to venture out onto the streets. When they were stopped, they ganged up on these policemen, threatened them, allegedly pelted stones and even hurled abuses on cops on duty. What more do we know on these youth? Have they been taken in?
See, Dharavi, the biggest slum in the continent, there have been positive cases found in Dharavi as well. Now, last evening, there was death of a 50-year-old person, 54-year-old person. This morning, again, a 51-year-old person has been found positive. Amidst all this, government is taking all possible measures. These areas have been contained, these areas have been sealed technically, so that people cannot venture out, people should not venture out. That is what is being advised. People from outside are not allowed to enter these areas so that the community spread could be contained. Amidst all this, this group of men who were asked by policemen to stay indoors ventured out, and then when asked by or when confronted by police officials, they got into a confrontation, and then also in the visuals as we see, they attacked police officials using stones. They hurled stones at them. 2 of them have been arrested, while remaining are still at large. The police is still on lookout to arrest these possible suspects. Over to you.
Right. Devesh, thank you for joining us. Risking your own life, you're venturing out, but here is a situation that we've got to face. While the debate is still on whether everyone should wear a mask or not, the CDC has now, in fact, the CDC in the US has now taken a U-turn and claimed that masks are essential for all. This even as the WHO claims that only healthcare professionals need to wear masks. So what should we really do? We break it down for you in this report. Take a look.
A global scramble for masks. This despite the official advice from the WHO not to wear them if you aren't sick and aren't caring for coronavirus patients or suspects. America's Center for Disease Control and Prevention is now likely to change the official guidance. The CDC is considering recommending do-it-yourself cloth coverings. You don't need surgical or medical grade masks. But homemade facial protection like this isn't a bad idea if sewn in safe and hygienic conditions. Many in India have now also begun to believe any mask is better protection than no mask at all. Dr S.P. Byotra of Delhi's Sri Gangaram Hospital endorses wearing homemade masks amid the pandemic.
We don't advise everybody to wear N95. N95, yes, especially we are taking a special precaution. People who are dealing with the patient, people in a critical care, people in the casualties, people at home. You can take a normal cotton cloth, put 4 strings over there, and ladies can use their dupattas. We take our hanky, put over there. They will at least we can protect others from something. When we are coughing, our droplets will not go that far off.
Officially, though, India is still guarded about facial protection. The government's thrust remains on social distancing. Health authorities at the same time have indicated new guidelines may soon be issued about homemade masks.
हर लोगों को अवगत करना चाहते हैं कि मास्क सबको पहनने की जरूरत नहीं है. आपको मास्क से भी ज्यादा जरूरी है कि आप अपनी सोशल डिस्टेंसिंग 1 मीटर तक का डिस्टेंस रखें और आपको अगर कभी खांसी और उस तरह से खुद हो तब आप मास्क पहनें.
Social distancing is indispensable in the fight against COVID-19. For people, masks serve as an additional physical barrier against infection.
Experts say that you don't need a N99 or N95 mask to protect yourself from those who may have developed symptoms of COVID or those who may be coughing, because the size of the virus is bigger. Hence, a normal cotton cloth or a normal covering for the mouth would also do.
Daily mask wearing is a social etiquette standard in East Asia. Japan, for example, produced more than 4 billion masks for private use alone in 2018. Some say it's probably Japan's mask culture that's helped the country slow the spread of coronavirus despite having multiple hotspots. India has no culture of mask wearing. But as the pandemic worsened, ordinary Indians have embraced the protection on their own. With Milind Sharma, Bureau Report, India Today.
Now, India is trying to ramp up testing for coronavirus with the help of indigenously developed test kits in a move which can scale up testing faster result delivery as well. Pune-based private firm MyLab has partnered with Serum India and APG Group. This will lead to enhanced funds for scaling production of COVID-19 test kits and expansion of molecular diagnostic solutions there. MyLab is the first to get a government nod for its Made in India COVID virus testing kits. The company is manufacturing 1 lakh testing kits a week to fight shortfall faced by private labs. Several leading labs are procuring test kits from MyLab now.
We have to work on making this quality products in quantities so that it reaches to masses, and on that aspect only we have been working day in day out. It takes some time to plan the production in such a great speed, and I think with the new partners coming in, we are all well to go in next 1-1.5 weeks time.
We do have Hasmukh Rawal joining us live, Managing Director of MyLab Discovery Solutions. Mr. Hasmukh, please do tell us, you have invented this test kit. You're also partnered with another company now to get some funding. Please do tell us, how are you going to go about carrying out these test kits?
So of course, definitely we have to work on making this quality products in quantities so that it reaches to masses, and on that aspect only we have been working day in day out. it takes some time to plan the production in such a great speed. And I think with the new partners coming in, we are all well to go in next 1 to 1.5 weeks time.
Quickly going over to New York, which has become the epicenter of coronavirus in the United States with over 80,000 cases and over 1,900 deaths so far reported. The pandemic has forced millions of New Yorkers into their homes as local and state government enforce another 30-day stay-at-home order to try and flatten the curve. My colleague Gurmeet Sindhu brings you a report from America's hotbed.
All house of worships are closed in and around New York, and it's been of course ordered by law that you cannot have a gathering or any meetings of more than 5 people at a place, because of which all of these the temples, the churches, the mosques, the gurdwaras, all house of worships have been closed. There are signs posted outside that of course unfortunately they can't be opened for anything. This is one place where, you know, people can find going to their temples or to the house of worships, but they could find peace and find some solace. And, you know, in general, older people, they would usually come here in the afternoons.
Now, why is the debate around the use of masks being revisited? One theory that many experts believe is the one mode of transmission is of micro droplets emitted while sneezing, coughing, and even during conversations. These micro droplets might remain suspended in the air for hours, and if you aren't wearing a mask, you could be at risk of inhaling them. An experiment carried out by NHK Japan's National Broadcasting Organization elucidated this all the more.
An experiment carried out by NHK, Japan's national broadcaster, found that micro droplets emitted while sneezing, coughing, and during conversation stay in the air for longer than normal droplets, potentially posing a unique dangerous risk for coronavirus infection. NHK conducted an experiment under expert guidance using laser beams and high-sensitivity cameras, which show most droplets from sneezing and coughing are relatively large, so they quickly fall to the ground. But micro droplets can remain in the air for longer, until a few hours. In what situation are people at risk of inhaling these droplets? Closed spaces. The conversations.
そのマイクロ飛沫、小さな粒子の中にもたくさんのですね、生きたウイルスがいて、大きな声での会話、あるいは激しい息遣い、そういった中でですね、このマイクロ飛沫ができて、それが近くの人、その人が吸い込むことによって感染が広がる、そういったリスクが見えてきたものと思います。
Till now, there have been 2 main known transmission routes. One coming in contact with objects that have virus on it. The other, inhaling droplets emitted through sneezing and coughing by an infected person, if one doesn't maintain 6 feet social distancing. Now, with this theory of a third infection route of micro droplets remaining suspended in the air for hours, the need for the use of masks cannot be emphasized more. Bureau Report, India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.